heart to heart. And that's what we are actually here for. I'm Lucy from UK, as Dr. Maha already introduced, and I have had severe asthma from my childhood, from the time I was about 9 years old. And it's been really bad that I've ended up on life support so many times because of asthma. I've spent a lot of times in intensive care, a lot of times in hospital in the last 9 years than I had spent at home until I discovered STC30. I was speaking to my brother in Ghana, his name is Danny, one evening, because I had been telling him all the time, oh, I'll be coming this Christmas, I don't come, and I tell him, you don't worry, I'll surprise you. So that day I got the courage to really talk to him about what exactly is happening to me. And at the time, I had so many complications because of medication. And I had a catheter, so I couldn't pass urine normally. So I had a catheter. And the biggest thing that everyone saw was that I couldn't walk because I was in a wheelchair. And I had been in the wheelchair for over 4 years. So I was telling my brother that, listen to me, if I tell you that any plane will be able to bring me to Ghana now, it's a lie, because I can't walk, I can't sit up for more than half an hour. Even when I'm going for appointments, I have to be on a stretcher, and at home, I can't sit up straight. I have to sit in my recliner chair. That is the day I'm able to be hoisted out of bed. Through complications, I developed what we call peripheral neuropathy. So when you don't have any sensation in your feet, and sometimes too, when you get sensation in your feet, it feels like pins and needles. So when I'm helped out of the bed with the hoist, I had a standing hoist, and I weight bear, it feels like stepping on broken bottles. So for that reason, I couldn't weight bear at all. So it means that I couldn't stand, even with the help of the standing hoist. And it went on, and things got just from bad to worse. Every single time I'm going for a hospital appointment, I'm a bit nervous because I don't know what they are going to tell me that is wrong again. So from 2011, I had a cardiac arrest. 2 years later on, I had a massive blood clot in my lungs that nearly blocked the whole of my right pulmonary artery. So they said to me that, listen, you have to be on certain medications for the rest of your life. I had non-reproducible lung function, which means that they couldn't even get a baseline value for my lung function because my lungs was not functioning at all. I was on so many medication for my asthma, including steroids, oxygen at home, and nebulizers. At a certain point, I was taking 33 tablets in a day. That was sometimes 16 in the morning, 4 in the afternoon, and then another 4 run about tea time, which is like dinner time, and then the rest of them have to be taken when I'm going to bed. So when I told my brother about all this, he said to me that, look, there is this supplement, and mind you, I had tried a lot of other supplements from different companies, you know, but a lot of them, because of how it is taken, which is they say you have to be swallowing. From the number of times I had been on life support, my swallowing was gone. So I couldn't just take water and drink. It had to be thickened. Sometimes I had to be fed through a tube through my nose. And almost every part of my body was affected, that the doctors were even considering a catheter that come out of my tummy. So they call it a suprapubic catheter because I was getting recurrent infections in the catheter, bleeding, and all sorts of things. So when my brother started telling me that, oh, it's done this for that person, the doctor who was telling him about it, the mother had stroke, but the mom is now walking. Actually, when he was in the office speaking to the doctor, the mom came around. I said to him, I said, enough of all those people's testimonies. Listen to me now. I want a testimony for myself. And trust me, if this STC 30 is as good as you're talking about, if it helps me, then you have to run away because we're going to be bothering you. So we sent him some money to order some of the products for us from Ghana. And I took, for the first 2 weeks, for the third day, I told my mom that this is going to work. And she said, why? What have you seen? And I said to her that, do you know that yesterday I forgot to take my sleeping tablets? And she says, okay. So the next day, when I went to bed a bit early because I was feeling very tired. Every morning, I feel like I've been beaten because sometimes I'm going 5 good days with no sleep. And you can all bear with me that if even you sleep and you don't have a good night's sleep for one night, you wake up and you're already grumpy because you can't be yourself. So that night, my mom was thinking, should I wake her or should I not? And she said, okay, let's see, because the maximum I used to sleep was 4 hours. And I had slept past 4 hours. I had slept 5 hours, 6 hours. I was still asleep. She said, okay. So she didn't wake me up. In 6.5 hours, I woke up. Usually when I wake up in the night, it will be because I'm either in pain or I'm feeling breathless or I'm uncomfortable. But this time, I woke up not feeling in pain, not feeling breathless, nothing. I woke up because I had slept enough. And she was marveled because she was saying to herself that you usually not sleep like this much. Even when you've taken the sleeping tablets, you can sleep for only 4 hours. So I decided that, okay, for the rest of the week, let me not take it and see if I'll still be able to sleep. So I carried on taking the STC 30. And when you are touching my feet and I'm not looking at you, I wouldn't know anyone is holding my feet because I had no sensation in my feet, especially when I'm lying down. I've got a hospital bed. I've got a special pressure relieving mattress so that I don't get a lot of bruises because I couldn't move even myself in bed. And I could coordinate to wiggle my toes. So I called my mom. I said, come and see something. I think something is happening here. And she said, what is it? So I closed my eyes and I wiggled my toes and I asked her, I said, can you see? She said, no, I didn't see it. Do it again. I did it again and she said, I didn't see it. Do it again. And then I did it. So she was happy. That afternoon, I was there and my phone was ringing and it dropped because my phone is always on vibration because that's the only way sometimes I can feel that my phone is ringing. And the phone dropped off from the bed. The next minute, I realized I had turned myself trying to get the phone. So when I came to my senses that, oh, I've actually turned, I called my mom and she came and she was like, be careful, you fall out of bed, because I had fallen out of bed quite a few times in the past before then. And I said, no, I'm not falling out of bed. All I saw is I have turned to pick the phone. And she says, okay, if you did it yourself, if it's not any adrenaline rush, turn back in the bed and try to pick the phone again. So I turned and I was able to turn back and pick the phone. And then I was thinking to myself, is it actually real? Is this happening? Because I couldn't even bring myself to believe that I'm able to do so. So the next minute, later on in that day, I said to her that I want to sit out in my chair because I couldn't cough up. So I tend to build a lot of mucus and I kept getting chest infection upon chest infection upon chest infection. So as part of my treatment, I'm supposed to do airway clearance and they want me to do it sitting up. But because a lot of times I couldn't sit, I couldn't do it. But that particular day, I felt I had so much energy. So I said to my mom, I want to sit out. So she went to bring the hoist and then she helped me and I was able to weight bear on the hoist to pull my weight and to stand on it. So she said, this is very good and your legs are not shaking. Usually when they get me on the hoist and they try to bring me up like to a standing position, my legs would just be constantly shaking. So that day, it didn't shake for the first time. It wasn't doing that. And when I sat in the chair, usually the maximum I'm able to sit even in the recliner is 2 hours. And I'm in so much pain, I just want to go back. But interestingly, when I sat in the chair that day, I sat for 3 hours. And since I started taking the STC 30, what I realized is that it wasn't difficult for the phlegms to come out. In a day, sometimes I could bring up a lot of mucus as much as where my hand is on the glass. So I was quite shocked because I didn't know that I had all this stuff in me. And very soon, I started being able to walk with my Zimmer frame at home. So one day, I decided that, okay, let me try and see if I can walk without the frame. When I started to weight bear, because I didn't have balance, because I'd been lying down and my body was used to that. Whenever I get up from even the sitting position in bed to sit at the edge of the bed, I feel quite dizzy because my blood pressure dropped. Because for a long time, my body is used to just lying down. So what happened was, initially, when I tried to walk with a frame, I started the rehab with my mom before we were confident and we told my physiotherapist. So when she also came around, she said, something is really happening here, isn't it? And then we were laughing about it. I said, I don't even know if I'm dreaming or if it's true. And she said, okay, we'll help you with more exercises to strengthen and to be able to stretch. I started taking the supplements early November. And by the 3rd week, which was 18th November, I was able to walk out of the house with my mom to a nearby shop. And then the Saturday, I was able to go to a nearby park with my mom and my daughter. And she was so happy because for a long time, a lot of her birthdays, since her 2nd birthday, she spent her birthdays with me in hospital. That even her 6th birthday, she brought her birthday cake and all that. So for her to see me walking beside her, she was so amazed. Although she wasn't feeling well that day, but for her to see me walk, that was enough to boost her up, and she was happy. She couldn't stop singing. She was overexcited and all that. Carrying on, I wasn't thinking of telling my doctors at the time because I wasn't even sure whether it was something actually happening, or I couldn't bring myself to believe what all that was happening. So in January, I went for an appointment. In December, I was able to go with my sister and we went to see Greenwich, the Maritime Museum, where Greenwich Mean Time starts from. So we went there with her friend as well. And the whole day afterwards, we went on a cruise on the Thames and we came home quite late. One of our pastors was coming to visit us. And I had forgotten that he said he was coming that day. So when he came and the wheelchair was there and he asked, he says, oh, where's my girl? My mom told her, oh, she's gone out with the younger sister and her friend. She says, gone out like what? He says, yeah, she walked with them and she went. So when he said, no, I'm going to wait to see for myself if this is actually true. And he waited until we returned home quite late. And when we were coming, I walked and I went to hug him. He said he couldn't just believe it. I got no infections during the winter. I decided not to take the flu jab because I wanted to see if I'm actually better or it's just a camouflage. So I didn't take the flu jab. I had no flu during winter. I had no severe asthma. Okay, I needed no antibiotics for whatsoever infection. And usually the winters are my worst. Usually by Christmas, I'm not feeling well. Sometimes I try to stay at home by 26th. I'm in the hospital. I spend New Year in hospital. This was the first Christmas that I was well. Everyone was happy. We had a big Christmas dinner with family and friends, and we all danced the night away without me feeling extremely tired. So I said to myself, okay, I think this is really working. So I have to probably let the doctors know. When I went for an appointment in January, they did blood tests. And at the time, I hadn't told them yet. When they did the blood test, they couldn't believe that it was my blood test results, because all the time I had borderline issues with my liver because of the medication I'm taking. And I had flags in almost every single organ is flagging up in there. When they did the blood tests, and for the first time there was no flags, so everything was normal in the blood test, they called me. They said to me, your results are in, but we think that it's a mistake. So I asked them that, what mistake is it? And they said to me that, well, they think they have wrongly labeled somebody's blood test, because this cannot be Lucy's blood test. Lucy's blood test has always got flags. This blood test had everything okay, so we don't believe it's yours. They sent me to my local hospital for them to do another blood test to confirm whether what they got was true. They also did it, and they also called me that they think the same issue has happened again, meaning because I did it in the hospital, there has been a mix of labeling or something. So they then sent the nurses to come home and take the blood. So when the nurse came, I asked her, I said, are you taking anyone else's blood? She said, no. I'm taking only your blood because we want to clear up this confusion once and for all. And I'm actually taking it to the lab myself and waiting for them to process it and take the results myself to the doctors. So I said, okay. And because of the steroids I've been on, my blood sugars have been all over the place. So I had type 2 diabetes, which is not only that the blood sugar goes up, but in my case, in the middle of the night, the blood sugars were dropping very low. And sometimes when I eat too, the body releases too much insulin and it drops the blood sugar. And sometimes I'm not awake. I'm unconscious because of that. So when they did all those bloods, so they didn't let me eat in the morning. It was fasting bloods. When they sent the bloods, because they did it as urgent, in 4 hours, the first set of results was in. And they said to me that the second set will be in a week. About 10 days later, I had a call from the hospital and they said to me that, Lucy, it's actually true that it was your blood test, because the last one we did was even better than the first two that we've done. So tell us, what has been going on? So I was meant to see them in 2 days. So I said to them that seeing is believing. So I'm coming to show it to them. When I went, I got out of the wheelchair and I walked to the consulting room, and the doctor was like, I can't believe this. You're actually walking with me to the consulting room without any oxygen. I said yes. So I showed him the box, and I actually showed him the sachet. And I had one of the leaflets, the flyers of the STC 30. So I said to him, I said, you can Google it as well, but this is a summary. If you want, I can leave it. So the nurse said, no, she wanted it. And the doctor said, oh, I'll search for it for myself. So I left, and they were very happy. For the first time, they were able to measure the inflammation in my lungs, which was normal, in normal limits. So they said, okay, which means that this thing that you're taking, what is it? And I said, well, I'm told it's a plant-based stem cell supplement. And so they were asking lots and lots of questions about it. So a lot of my asthma medication, I had already tried to stop taking some of them. And they asked me, they said, have you been taking everything? I said, no, I stopped taking this time. I stopped taking that this time. And I was on one tablet, which was also causing my heart to be racing all the time. That was aminophylline. I told them that I've stopped taking the aminophylline tablet. They said, what? I said, yes. And I'm still not feeling like overly breathless or anything like that. So they said they'll still keep an eye on me. So then they sent me for a lung function test to find out if truly my lungs had improved. And they booked the lung function test for August, because I told them that for June, because I told them that I would be traveling in August. And for 9 years, I haven't been fit to fly because of my high oxygen requirements and because of the cardiac arrest I had, and because of all the medical stuff I have to carry with me, no airline will pick me unless it's a medical evacuation flight, because I need specialist equipment even on board the flight. So I hadn't been able to travel, but I told them that I'm feeling well enough and I feel I need to be able to travel because I'm going to meet family as well. So they said until they've done the lung function test, they can't tell me that I'm fit to fly. So I agreed. And even prior to that, I had been able to stop the medication that I'm taking for the nerve pain because I wasn't getting that neuropathic pain in my foot anymore. So when I told the doctors, they said, okay, try without it and let's see. I tried and then I was still fine. What happened next was I went to see this other pain consultant because I was on a lot of pain medication, morphine and morphine patches and slow release morphine preparations as well to try to help me keep on top of my pain because I was in so much pain all the time. I never knew that there was life without pain because that is all I know, pain. And when I started taking the STC-30, my dependence on the pain medication had gone down. That certain days I'm not needing any morphine for breakthrough pain. So when I went to see the doctor, he was really improved. He was impressed about the improvements. And even when he called my name and I went, he said, I asked to see Lucy. And I said, yes, doctor, this is Lucy. And he says, and I smiled and she said, the smile looks like Lucy, but you have changed because you used to be very big and you used to always look tired. You always looked very sick. But I'm seeing smiling Lucy, not in pain and sitting, because every time he had seen me in the clinic, I had been on a stretcher. Because of that, he was amazed. So he got keen to ask, what have you been doing? And I was telling him about it, and he says, oh, okay. So how would I be able to get it? Can I recommend it to other patients who might want to try other things privately? And I said yes. So I told him that he can contact my mom. So I gave my mom's contact details to him, that if somebody would want to try, my mom has registered as a distributor, so she would. So after 4 months of taking STC-30, I decided to do a testimony service at church, after which I thought about it that other people are suffering like myself. If even not up to what I'm suffering, they are. So why not also get on board? Just for the passion of telling people, spreading the good news about STC-30 and sharing my testimony, because I know that it's helped me in so many different ways. And it will be able to help them because it wasn't just one condition. People are giving testimonies about just ulcer. People are giving testimonies just about diabetes. But for me, it's a long list of conditions. I've been diagnosed with over 14 different medical conditions. And as we speak now, a lot of them have been resolved, you know, from taking STC-30. In total, I took STC-30 for 6 months and I stopped taking it for a month, like someone said earlier on, to try and see if it's because I'm taking it, that's why I'm feeling well. But interestingly, even the time I had the break, I was still okay. But because I knew that I've suffered for so many years and I wanted the body to be able to heal completely, I still decided to take at least 3 times a week. So I took it like that for some time, and then I went back to taking it every day, every day, every day. As I speak to you now, I'm not only taking STC-30, I've started taking the SIC just before the time we were meant to go for the Thailand trip, because I wanted to boost my immunity more. And it's been wonderful. I've not needed to take any, like I used to take about 4 courses of antibiotics in 3 months. But since starting STC-30, the rates and the level at which I get infections is insignificant. Sometimes I go over 6 months without any infection. The whole of last year, I only took antibiotics 3 times in the year of 2019, which to me is very incredible because my routine was take antibiotics almost every month. So because of that, I have rescue antibiotics, and I've been cleared to fly. I flew to Amsterdam last year in August, and I had no problems whatsoever. I didn't require any oxygen on the flight, and I came back. My doctors were happy. So when I told them that we were going to Thailand, they said to me that they have no concerns for me to fly to Thailand, although they know it's 12.5 hours from UK, but they were happy to clear me to fly. Due to unforeseen circumstances, I couldn't go for the Thailand trip, but I'm looking forward to the Dubai 2021. So what I'm going to say is that STC 30 is a miracle product of our time. God has brought this STC 30 to liberate us from sicknesses. If you are having doubts about trying to take it, I want to encourage you that give it a try, because your miracle might be in this supplement you're trying to avoid. And if you know people who are suffering, recommend it to them. Yours is just word of mouth, because someone's answer to their prayer might be in the testimony that you share. So keep taking the STC 30 and keep sharing your testimonies. And I know it will bless the lives of so many people. Not only myself has the STC 30 helped, it has helped a lot of people I introduced it to. People recovering from tumors in the bladder, people recovering from near blindness, people recovering from arthritis, people recovering from strokes. I have a lot of testimonies from my personal team. So what I want to encourage everyone, that STC 30 works. Try it for yourself and you'll be amazed. Thank you.
Thank you so much, Lucy. I really, someone wrote here, they said that they have tears listening to your presentation. You really move us. And how young are you, Lucy? What is your age?
Whenever I say my age, people don't believe me, because I'm looking a lot younger than I used to. I'm looking a lot slimmer. Just one moment. I want to show a picture.
Guys, you see what?
That was me. That was me and my daughter.
Oh, okay.
So I was very big, but now I'm looking this slim. I feel younger. I feel healthier. I am 31, but I look nothing like that. Whenever people ask me, and when I say 20, they are like, what are you on about? You're just a teenager. Just try to enjoy your young life, But I've got an 11-year-old daughter, so I can't